TopMedTalk.
All right, and thank you for joining us again at AANA 2018, the American Association of Nurse Anesthetists Annual Congress here in Boston, Massachusetts, home of anesthesia, actually. We were talking about that yesterday and have a podcast coming out this week about anesthesia in the Ether Dome over at Mass General, which is really cool. This morning, I have with us at TopMedTalk, we're very privileged to have the incoming president of the AANA, Garry Brydges. Thank you, Garry, for joining us.
Thank you for having me.
Yeah, so Garry is a CRNA from Houston, Texas. He's been working at MD Anderson there and a leader within our space of CRNAs and really perioperative care in general. So I'm really looking forward to talking to you about that today, Garry. So first of all, have you made it to the Ether Dome? Have you ever been there before?
Unfortunately, I have not, despite being here probably the last 3 meetings that have been here over the last 15 years. The education content here
is fantastic.
It's a huge draw, and I think that the quality of didactic content that you get. I mean, we look at the vendor space, the opportunities of networking that we get to share with our members is an invaluable experience. So it has not led to free time to go down to the Ether Dome, unfortunately, although it is on the bucket list since it is a space we live in. So,
that's maybe time for a personal vacation if that ever happens.
I don't know what that is.
Yeah, I hear you. I'm right there living that too.
Yeah.
So let's start out by first talking a little bit about your incoming presidency. Bruce has done a wonderful job over the last year leading our organization, but really looking forward to you taking over the helm. So what are you looking forward to?
Absolutely. This is going to be an exciting year. As you may or may not know, we looked at the culture of our organization, and I think it's a really important framework to start building the platform for the future moving into this year. Of course, shifting a culture is not going to happen overnight. It's not going to happen within my term, but we're going to start to make inroads. I think self-reflection for everybody is critical, right? But moving forward, we're going to use that as the framework to start developing and pivoting our focus of the organization to what we will define as the member experience. And it's critical. And we're seeing a lot of elements that we're going to engage members into, so shifting our culture is going to be paramount that members become engaged. Help drive the future and the change of this organization to excel it, not that we're not only a great organization today, but to make it even better. And draw in more people that want to be members because they're like, this is a high-functioning organization. And so some of those things briefly is really looking at clinical excellence and education of our membership. Diversity is a big component. And as I think back even 15 years ago, our membership was less than 25,000. It's 52,000 members.
Yeah.
Right? It has exploded.
Yeah.
And so there's a lot of different needs. There's a diverse population. There's diverse thought, which we need to use as part of the drivers or the engines of moving in and changing that culture. There's a number of services, the healthcare insurance marketplace is being disrupted right now.
Yep.
Critical that we play in that space. And so I think that we're exploring the opportunities to offer many of our members that are out in the communities and rural sections of the United States that may not have healthcare insurance, or they may be paying exuberant costs for their healthcare insurance.
Yeah.
So maybe we'll be looking at, hopefully here in the near future, as that being a membership benefit.
Yeah. Some of the resources I think that the AANA offers for the members are fantastic.
Yes.
But honestly, when it comes right down to it, it's just the support of each individual member. Like, I know that over the course of my 11-year, career, that there have been times when I've called the AANA about very specific questions, and I've always been taken in with open arms. And everyone's been very attentive to my personal needs, to the needs of my hospital, of our state,
yes,
and nationally.
Yes.
And so I think that's to me, one of the biggest benefits is just that I know that I can call on the AANA at any time and talk to Garry Brydges if I need to,
Absolutely.
or Lynn Reed, who is director of practice and can help guide
Yes.
and mentor us. So I do appreciate that, and I think that is one thing I'm looking forward to your presidency as well, knowing that is really important to you.
Well, it is. I mean, we're all in this together as an organization, a profession, and to actually give a brief plug for our staff at the AANA are unparalleled.
Yeah.
I work with a number of administrative people, even in my own workspace, and nobody compares to the staff at the AANA.
Yeah.
They are exceptional. And that's part of the framework. If
Yep.
you don't have a good, strong, cohesive, innovative, mature staff that, is sort of the springboard to the development of the organization, these people are incredible.
Yeah,
Incredible.
the team's awesome. One of the things, kind of getting into something very specific, but near and dear to me, and something I'm very passionate about, and I know to you, is talking about the Enhanced Recovery Shared Interest Group that the AANA is piloting. So talking about being innovative, and the AANA really taking to heart what's important to members is support through shared interest groups.
Absolutely.
And I know Randy's really passionate about that
Yes.
as well. So, and I know that you are really involved in this space. So can you tell me a little bit about how you've gotten into the world of enhanced recovery and what it really means to you personally?
Sure. In our facility at MD Anderson Cancer Center in Houston, we've been doing enhanced recovery. It's coming up on a decade now. And I can tell you with one of my colleagues, Dr. Vijay Gadamakala,
Love Vijay, who's been on TopMedTalk.
Oh,
before.
good,
Yeah.
Excellent. Yeah. So we participated in honing out a plan which, I think there's healthcare providers in general have a resistance to change, right? And so that's...
We all know that.
And I get that every time I give a talk on enhanced recovery. It's like, how do you do it?
Yeah.
I mean, people are, so resistant. And you have to be selective on your champions. And I think that certainly at our facility, building that team of champions is the primary step for success.
Yeah.
If you don't have buy-in from everybody, the programs are not going to be successful. When you implement and execute a program, there's a lot of tweaking that's involved with these pathways. But when you get an opportunity to witness how well these patients do, and here's what's interesting, and certainly where I want to see things go in the future is, even within the anesthesia space, those small changes that we implement, the outcomes are disproportionately larger.
Yeah.
I mean, it's profound, the outcomes that we see. And then when you start looking at healthcare economics...
Oh, yeah.
That space is even more profound. We look at, earlier discharge times, the comorbidities that we, iatrogenically impose on patients, right? Using opioids, using inhalation anesthetic gases. Yeah. We don't have to do that anymore. Yeah. There are alternatives. There are pathways that have been created now, and that body of knowledge is exponentially growing in the literature. And so when people want to develop or implement these types of programs in their own workspace, it's quite easy to do now. It's just a matter of the relationships that you have to cull within your workspace.
Yeah. One of the things that we talk about, too, is how we develop this into not just enhanced recovery, but perioperative care in general.
Yes.
And I asked Bruce earlier, we're going to call our new shared interest group, it started out as enhanced recovery after surgery, so ERAS. But one of the things we talk a lot about on TopMedTalk is, is it a misnomer? Should we be calling it, enhanced perioperative care? What are your thoughts on that? And I know anybody that's experienced enhanced recovery for even a short period of time realizes that it's not just about recovery. It's about the health of the person and through the perioperative space.
Yeah, I think it is a misnomer because it isn't just about the recovery. There's prehabilitation before the patient even gets to surgery. Again, those relationships that we develop not just nursing, but even in the clinic when the patient comes in. Are they fit enough to be having surgery? Because that's a major stress on the body.
Yeah.
And there are physiologic changes that happen with that. And the good thing is that we're able to blunt some of that now with these techniques. But yeah, certainly, I've never really given it much thought other than, again, sort of like the member experience, it is the patient experience and how we define that experience.
Yeah.
I think one of the key components is making sure that the patient is a member of the team.
Yeah.
Right?
Yeah.
It's probably the best litmus test as they go through that journey where they hold us accountable, and I think sometimes the patient experience is perceived as the Disney experience, and that's not what we should be, the objective. It's not coming in with the fancy bowls for your dinners and stuff, right? It's here's the pathway when you set foot into the institution to have your procedure, your workup. Here's the milestones you need, and then you need to ask questions. If you're falling off the pathway, talk to us.
Yeah.
Right?
I always talk about it's all about expectations.
Yes.
So what the patient expectation is for us, but now we are actually taking into account what their expectations are for their care.
Yes.
And that's where you start with it. And then kind of go from there. I think that works. One point, kind of going back to what you were saying about the different aspects of enhanced recovery or perioperative care is that prehabilitation part or getting their functional status up.
Yeah.
I think that we need to start talking more about and promoting the use of enhanced recovery in practice is how we're really contributing to improving population health and the overall health of our communities and of people in the healthcare system and abroad, right? And so, is there anything that you're talking about? Do you lecture on that at all, or have you started having those discussions?
So, as a result of implementing these types of pathways, yes, again, we get into a patient comes out of a procedure. It's not just the patient. There's family members that are affected by it, and when we not only prehabilitation but post-operatively, there's a lifestyle change that has to be implemented, and there's a level of accountability there. Yeah. And one of the things that I would like to see is better tracking of things like what are the comorbidities, what are the symptoms, that we would need to be engaged to rescue should there be, fatigue is an issue.
Cognitive function post-operatively.
Exactly.
Yeah, we talk a lot about brain health,
right?
And how that is. We haven't really looked at that yet.
We haven't, really. And I think those are important elements as to full rehabilitation. Hopefully they're going to be better than when they came into the hospital, but certainly we don't want to see them going backwards on their trajectory of recovery.
I've been calling this now ERAS 3.0.
That's because we have. We've gone through a number of iterations of the progress and where we're seeing the benefit. And how to move or how to change the conversation as you move through it. Absolutely.
You're going to have different conversations with different people, and if you've been doing it for a while, start having these things about your brain health, cognitive function, AKI. Let's start looking more at that intra hypotension.
Right.
Some of those big things that maybe when you're first starting out you can't really do.
And maybe we not even be cognitive of some of the effects of making sure that we're meeting some of these milestones throughout that trajectory of care.
Yeah. So that kind of takes me back to the SIG, the shared interest group. So what do you see as the primary benefit to CRNAs in first, but to even a greater group of individuals and healthcare providers? How do you think that we're going to be able to use this?
So, I'm excited about the SIG that, we'll have a core of experts that will have not only shared interest within that space for the profession that actually acts as resources for CRNAs across the country, but it's not just us. It's involving the other interdisciplines. That's perioperative nurses, operating room nurses, physicians, pharmacists, nutritionists.
Yeah.
The list just continues. And it would be my hope to see a larger platform emerge from that would involve all disciplines across the healthcare system, and not just healthcare providers, right? I mean, we need to start thinking about healthcare policymakers, economists, patients.
And I was going to say patients.
Right?
Yeah,
I mean,
absolutely.
That's the core.
Yeah, we had a big conversation about that at our meeting yesterday, was to be able to, how are we going to bring patients into this?
Right, absolutely.
Into the picture.
I mean, and they're a key stakeholder. And
absolutely.
I mean,
they're primary stakeholder,
right.
really.
Well, and I mean, look at groups like AARP. I mean, there's a partnership with Brain Health and the American Society of Anesthesiologists, who we're going to start to participate in that space here in the near future.
We actually had a conversation with the president of AARP on TopMedTalk.
Awesome.
Eric Schneiderwin. So we need to bring that out and start talking more about it.
Absolutely.
It's awesome.
I mean, what an incredible resource to help sort of catapult this entire platform of I'm curious to get to a different defining term for enhanced recovery, because I think it is self-limiting, with that sort of title, if you will.
Yeah. Well, Garry, thank you so much for sitting down with us and taking the time. I'm sure you have every little minute scheduled out during the conference.
Well, they certainly keep us busy here.
Yeah, they do, I'm sure. But I think it's meaningful to me personally as a CRNA, but also I think it's just so important to have these conversations and put them out for the broad audience to talk about just enhanced recovery in general, what we're doing as an organization, and how we want to collaborate with others to improve the outcomes and improve the care for our patients every single day.
Absolutely.
So, and it's going to start with conversations like this.
It will.
So,
absolutely.
Thank you so much.
What a pleasure.
Yeah. Well, so be sure to join us on TopMedTalk.com. You can find our podcast there. And be sure to subscribe. You can subscribe on your favorite podcatcher, Apple, iTunes, SoundCloud, Google Play, all those podcatchers. And please be sure to follow us on social media. We are on Twitter, Facebook, LinkedIn, YouTube, and share with what you're like, if you're liking what you're hearing, if there's any topics that you'd be interested in hearing, and be sure to follow. We're going to be putting new content out every day. Thank you so much, and have a great day. Garry, thanks again.
Thank you for having me.
All right. Bye-bye.
TopMedTalk.